Hi, everyone, and we are here yet again for another virtual health education. Today we have Mr. Drew Doyle, or better I say, Dr. Drew Doyle. He's a pharmacist by trade, and he's an executive vice president of sales and market development for Soleo Health, which is a national company specializing in infusion services. Thank you so much for being here, Mr. Doyle. And we'd love to hear more about home infusions and infusions. Thank you again for your time.
Well, thanks, Tannaz, for having me. It's a pleasure today, and hopefully it's a valuable session for everybody listening in.
Thank you. So, Drew, can you tell us a little bit about infusion and what infusion is and what medications are considered, go through infusion and what list of diagnoses and conditions you typically see with infusion?
Sure, I'd be happy to. Well, first off, the medications and disease states and therapeutic areas are seemingly endless. And that's what I think is so exciting, and what I call enriching about our industry is we get really close to the end users. And although the industry of infusion, we don't make the medications, we get to administer to the patients and take care of them in their home or an infusion center. And it's really exciting to be able to provide such a wide variety of therapeutics in the community. So I guess starting off, infusion therapy, as we describe it, is really the administration of a medication that just simply can't be given in other, maybe more simple ways, right? We've all taken oral antibiotics or even oral pain medications. We've all probably done something, intranasally. We've probably done dermally. But there's sometimes when patients have a treatment that they require that it needs to be more powerful, I guess, for lack of a better description. And it needs to be given directly into your vasculature, right? So a lot of medications aren't going to be effective unless you give them through an IV line, right? But it's not relegated just to intravenously. You can give an infusion subcutaneously as well. There's a lot of medications that you can give subcutaneously, and it gets delivered over a certain amount of time and a certain amount of frequency. So that's probably what differentiates a med that's appropriate for infusion therapy. Is it can't be delivered in any other way. And it has to be given in a more precise increment and a more probably the area that most people is probably the easiest to understand, and quite frankly, it's what our industry was built for, is IV antibiotics, right? Really an acute situation. So we try to break down our therapies as we treat acute patients, and then we treat a lot of chronic patients, right? So with osteomyelitis or endocarditis, right? Those are pretty significant infections that could involve both gram-negative bacteria, gram-positive, and you're simply not going to be able to wipe that out by taking oral medications, right? So, and it's usually given over an extended period of time, right? So we're talking not days, we're talking weeks in some cases. So think about before home infusion or infusion therapy, came about. That meant the patient was in the hospital length of time, right? And not just the inconvenience and quite frankly the cost associated with doing it. When you're in the hospital for any length of time, you open yourself up for more infection, right? What they call a nosocomial infection can happen. So what our industry is able to do is get that patient out of that setting, and a lot of times they may receive a dose or two in that hospital setting, and then they go home, and one of our nurses will come out, and this is I'm speaking for the industry in general, not just my organization. So a nurse will come out, a pharmacist will call you and review everything that's involved in your infusions, administer it to yourself. And so if you've got to give yourself an antibiotic 3 times a day, we'll teach you how to do that and teach you how to flush your IV line to make sure that it stays what we call patent, right? And every antibiotic's different. Some antibiotics are given once a day, and those tend to lend themselves to home infusion a little bit better, right? Because it's easy. But sometimes there's just simply no way around having to give multiple doses of antibiotics, and sometimes multiple antibiotics. So you may have 2 antibiotics. You might even have 3 in some cases. So that's an area that the industry does a lot of, because it's such a cost savings for the patient and the caregiver. Think about it. And there is an option for a patient to come into an infusion center for those types of medications, but think about how often that gets given in a day. So getting into a vehicle and driving to an infusion center 3 times a day, it just isn't
Especially for
pragmatic.
patients that have to do it like long term for their entire lifetime. It's a
Exactly.
lot of
So
inconvenience.
imagine, right. So imagine
Arranging
that.
your life to,
Oh God,
childcare, depending on whatever stage you're in, all the things that you have to do to coordinate to be able to be at an infusion center to do that. Correct.
exactly. And we do come across patients that maybe from a dexterity standpoint or just from a cognitive standpoint, they may not be able to grasp all that's involved, and it might lead to just a situation that nobody's comfortable with. And we do have infusion pumps that can deliver medications every so many hours. So sometimes the option just might be that we put you on a pump that's like almost like a little cell phone or a video game, if you remember those from the 80s, if you're old enough to remember those, Tannaz. But you can hook up medication to these devices and program them to deliver the medication every 8 hours. So there are some options, even if the patient maybe doesn't have the aptitude or doesn't have the support at home to be able to do it. And then we do a lot of chronic business in the home too, or chronic infusions in the home. So think about patients that have primary immune deficiency is a great example, and they need replacement immunoglobulin treatment, every month or every couple of weeks, and they need that for the rest of their lives, right? They don't produce enough antibodies like you and I do to fight off infection. So those are folks that get infusions as well, and same scenario exists. We can either come to your home and give you that infusion, or you could come into an infusion center that my organization has, or you could have an infusion at your physician's office in some cases. Some hospital systems have what they call HOPDs, hospital outpatient departments, that have infusion centers. So there's a lot of sites of care out there appropriate for infusion. And as much as our industry is about home infusion, right? We always pride ourselves on being able to take care of people in the comfort of their home. There are some for the patient, right? They may not want the rest of their family exposed to the illness. They may like the social element of going to an infusion center, in which case accommodate that as well. But it all depends on the patient. Some patients, they want their independence. That same example I used, Tannaz, around immunoglobulin, you can give immunoglobulin subcutaneously. We have patients that learn how to put 5 infusion sites in their abdomen and infuse their immunoglobulin every week that way, because they want the independence. So it really is a
Gotcha. So
really, really interesting.
yeah, that's great. Yeah. So basically, you know, infusion can be given in different settings, depending on the need of the patient, but home infusion tends to be a lot more convenient and, curricular things that are going on in everyone's life. Um, Drew, are all medications, let's say any patient, whether they have cancer, any immune deficiencies, anybody that gets an infusion, are they all qualified to get home infusion, or is it medication by medication? Is there an approval process?
Yeah, that's a great question. So as you might imagine, there are some limitations to certain medications, right? So there's some chemotherapeutic agents out there that are really caustic and have pretty significant side effects, where you're going to want those administered in a setting where there's access to what we call a crash cart, right? Where it's got all sorts of medications on there that if the patient experiences something really untoward or has, some medications have a higher tendency for anaphylaxis, and you're going to want those medications given in a place that has access to more urgent care, if you will. Now, the reality is, as type 3 hypersensitivities can happen not on the first dose, not even on the second dose. They might happen on the third dose, right? So we make sure that anybody who's getting medication in the home, they always have an anaphylactic kit on hand, so that we can respond to something that might happen, later on, deeper into their treatment. But there are a handful of medications that really are more appropriate to be given in a controlled setting, like surprised how many medications you can do in the home. I mean, one of the most complex infusions that we do is a product called TPN, or total. So that's pretty much a bag of food, for lack of a better description, and it's got proteins and fats and sugars and electrolytes and vitamins and all sorts of things. And it comes in a very big, could be a 3-liter bag, and there's a lot that goes into not just infusing it, but actually making it, right? The chemistry of the bag has to be just so, or else you could have precipitates that form, and that could interfere with their IV line. Like when calcium and phosphate get together, that's a party that nobody wants to be invited to because it can cause some problems. So you've got to be very careful with that. But I'm telling you, I had a time in my career, I'll never forget it. I was taking care of an elderly couple that were in their 80s, and she would add the vitamins to the bag. She would spike the bag, hook up the pump. It's sometimes amazing what, with enough training and the desire for independence, what people can do. So there's a lot of medications that you might not think we can do
Yeah.
in the home that you can.
I think it's like a personal preference thing and other aspects that play a role in that decision making. But I feel like if I was getting an infusion and I had to do it every week, even if it wasn't for the rest of my life, I'd like to do it at home instead of sitting in a hospital. But I can understand the social aspect. Drew, besides the clinical aspect that some medications will require you to be in a setting where there's like, if there's an allergic reaction, they can deal with it. Are there any factors, let's say, for example, is there an insurance coverage issue? Are all medications potentially approved for home infusion? Can our patients like reach out and or do they have to get approved? Is there a protocol per se?
Yeah, no, and you'll hear me say the word complex a lot, right? That's probably one of the more complex labyrinths that we've got to navigate when we're taking care of patients. Because let's face it, everybody's insurance plan can be different. It all depends. I mentioned Blue Cross Blue Shield only because that's a pretty vast national plan, and even in different states and different regions, the coverage can be very different. They could have certain formularies in place. So it all depends on what commercial insurance you have will dictate the coverage. I will say most commercial plans have some benefit or coverage for home infusion or infusion in an infusion center, right? So whereby you wouldn't have to go into the hospital. And that coverage can vary. Your out of pocket is going to be different depending on what the plan is, right? You may, if you chose a high deductible plan or a low deductible plan, it really all depends on that choice. But more often than not, coverage that should make it still an attractive option. And as a payer, right, it's certainly far less expensive to receive this care at home or an outpatient infusion center than to go into a hospital setting for that. And then, moving on to government payers, that amps up the complexity even more, right? So there's state Medicaid plans that will cover a lot of therapies, but there may be gaps in what they cover, and that's where companies like mine have to work with the patients to figure out, what kind of coverage it might be. Is there any other assistance that might be available? And then you get to Medicare, which unfortunately probably has the biggest flaws in terms of coverage, right? You'd think about folks that are eligible for Medicare, right? The elderly and the disabled. Those are folks who need coverage the most, right? And the coverage in Medicare Part A, B, and C is very nominal. There used to be coverage, but as you might imagine, that led to a lot of overprescribing of singular antibiotics. And as you know, that's not a good thing for resistancies and things like that. So there's really not, there's a few medications that are covered in Medicare Part B, but they're covered under a DME benefit, or get this, a prosthetic act, right? So that example I used earlier, total parenteral nutrition, that IV nutrition, it's covered on a prosthetic act because they look at the pump as a prosthetic stomach, if you can believe that. It's really not covered under an infusion benefit. So our industry is constantly advocating on the Hill with, we've got some great sponsors of some bills right now that are in legislative stages that we're trying to pass to get better coverage for Medicare beneficiaries. But for right now, what we've got to work with is Medicare Part D coverage, D as in dog, for the medications. But that's a flaw too, right? Like we shouldn't be counting on our services to be covered on a prescription drug benefit, right? That design was to cover, you need to go in and get your high blood pressure medication, right? It wasn't designed to cover IVM. And quite frankly, that's a very, very small part of the equation, right? It's really the services, the high-tech services, the nurses, the pharmacists, all the folks involved in that complex care. That's what we need reimbursement for. The drug just, if that makes sense.
Gotcha. Thank you so much for that. And I know that you touched on the topic of, healthcare cost saving. I know for payers and for healthcare in general, it saves a lot of money to go to home infusion, but is that the case also for the patients sometimes?
Yeah,
Is it cheaper for them to do at home?
typically it is. Sometimes where, again, based on their benefit design, and most companies, if they're responsible, they'll make sure that they educate the patient on all their options, right? Obviously, we want to take care of you in your home because that's what we do, and that's the rewarding thing that we do for patients every single day. But to your point, that may not be the least expensive option for the patient. So what many companies will do is assess the patient's benefits, verify that they do indeed have infusion coverage for the home or for one of our infusion centers, and then present everything to the patient. We'll say, hey, listen, your out of pocket to be seen in the home is this. If you go to this other setting, what I loosely call the provider setting, right? When we take care of a patient, we're seeing them in the pharmacy channel, if that makes sense. And if you were to go to an infusion center that's attached to a hospital, that's more what we call the provider channel. And sometimes receiving infusions in that setting could result in a lower out of, if they want to be seen there, because just like we were mentioning, they like to go in, they like the social aspect, they know all the nurses, they know Larry, they know Rita, they all sit together and have cookies and watch movies, and listen, that might be a
And
great
sometimes
setting.
it's not even a dollar amount. That's you and I recently worked together on a patient that she was a mother and had to arrange so many different things for her child was getting infusion, and we're working on getting them home infusion because it just allows her to live a more seamless life as opposed to trying to put this kid in school and then drive for like an hour to get infusion at this hospital for their child. So sometimes it's not the dollar amount, sometimes it's the convenience of it. So definitely it's not always translated in dollar amount. So I definitely agree.
No, that's a great point. Great point.
For sure. So Drew, just kind of like a recap per se, because it's such a huge topic and there's a lot of variables in there that we can't have like definite answers and definite, oh, it'll be cheaper, or had one or two takeaways in our session where our patients can go based off of and decide on home infusion versus in-clinic infusion, or anything that you think might be beneficial for them to know based on your many years of experience in this area, what would it be?
Yeah. So first of all, I mean, it's interesting, right? It's the type of service that you never think you're going to ever need, right? So you never get in a position where you have an infection that requires it, or you come down with a chronic disease and you now have to decide what the right treatment is for you. So the first and foremost, you want to become intimate with the benefit design that your payer or that your insurance carrier has, right? So you want to make sure you understand that that's an option, that's available to you. And then there's a great resource in our industry, and it's a foundation that we're very close with. So the NHIA, the National Home Infusion Association, has some great resources on their website. It goes over all the different medications that are available, a description of all the infusion devices, and it really gives a good overview of what infusion is, and what might be available to you in terms of resources. I always tell people too, especially on the chronic dosed with something, and I always use ALS because I feel like it's the biggest thief on the planet and in terms of diseases, right? And it's not to trivialize or take away from any other awful diseases out there, but it just is one that we got closer to in the last, probably half a decade because of some new products that infusible products that came to market, and it got us closer to that community. So it's one that has really touched me from an exposure standpoint. And there's lots of great advocacy groups out there. So God forbid you came down with ALS, the ALS Association. If, I mean, we take care of patients with GBS and CIDP, neurological condition, myasthenia gravis. I mean, take your pick. There is a patient advocacy group for seemingly everything out there, and those groups are great. So first, it'll give you a sense of community, and that's really important as you're battling through something as serious as one of those diseases. But they've got lots of great resources too, and they've got meetings and all sorts of ways to connect you with other people that are struggling with the same scenario. So I would encourage any members that you might have to seek out those groups, because they can be tremendous resources for you.
And yeah, you're absolutely right. There's always some sort of support group for anything you're dealing with. But one last question I have for you is, since you work for Soleo Health, at Soleo, let's say a patient wants to switch to home infusion from in-clinic infusion. Is there like a lot of our patients, I've heard that they worry about, if they have support in case like something goes wrong while they're getting their infusion at home. Is there like a nurse line, or are there nurses available that may come to you? What are the resources that can relieve that anxiety for patients that have never had home infusion?
That's a great question. So first and foremost, we have nurses and pharmacists available 24/7, right? So in the case of that antibiotic or anti-infective case where maybe the nurse isn't with you all the time, you have access to a pharmacist, a nurse, somebody, some anchor within the organization, patient ambassador. We've got lots of patient-facing resources that are available at our toll-free number. Now, in terms of some of the chronic patients, organization that's going to hook you up to, say, a plasma product like immunoglobulin, and wave goodbye and take off, and the nurse is going to go shopping. That nurse is going to stay with the patient, not just for the entire infusion, but make sure there's an observation phase afterwards just to make sure that they tolerate it okay, they don't have any, hypotensive effects or anything like that. So there's lots of therapies that we do, Tannaz, on the chronic side where the nurse stays for the entire infusion. I mean, so think about a lot of the monoclonal antibodies that have come out. Those can have some problems that may not present
Absolutely.
during the infusion, and you want to stay a little bit longer. So we have a nurse that stays with the patient for the length of the infusion and for a safe period of time, and it's dependent on what the medication is, how long we stay. It's usually based on manufacturer guidelines. So there's always somebody there that would alleviate any anxiety of receiving infusion therapy in your home, whether it's on the chronic side or whether it's for a short period of time of, say, antibiotics.
That's amazing. I'm sure a lot of people are stressed about switching from being in a healthcare setting, like you said at the beginning, resources available, and then being able to make sure that, they are able to get help, or for certain treatments, they have someone very
Such
busy.
meaningful
And
connections. Our nurses make such meaningful connections with our patients. It's amazing. As you might imagine, on
sure.
patient satisfaction
Yes.
surveys, the nurses are always called out. So
Yeah, I mean, I've worked with you guys, you and a lot of your nurses directly, and it seems like they have such a close relationship with your patients and always advocating. So that's great. I definitely know, but for our patients, just making sure that they know that they have that support system, that they're not just like, okay, here's your medication, you're done, bye
see you
bye.
later. Yeah, right. The
Yeah.
FedEx person off and say good luck.
Yes. Good luck. Perfect, Drew. Thank you so much for your time. I know you're very, very busy. I really appreciate you taking the time to go over these pieces of information that I'm sure put a lot of our patients' minds at ease on switching
Time.
to home infusion. And our patients have the opportunity to send in questions. If I do get any questions, I will definitely relay them to you and we can answer them. And
Perfect.
you can help me answer those questions as well. Thank you so much again, and I appreciate your time.
Oh, it's my pleasure, Tanaz. Thank you for having me.